Hey friends, welcome back. Today I am talking about COVID and sperm. I know I focused on this channel a lot on female fertility. I've talked about the COVID vaccine, but I really want to talk about something that I don't think is getting enough attention, and that is the impact of getting COVID on male fertility. To start, we don't have any evidence that getting COVID impacts female fertility. We haven't even seen early pregnancy outcomes. What we have seen is late pregnancy outcomes like preterm birth, increased hospitalization, intubation, and death risk for the mom, and higher rates of C-section. But we've not seen a higher rate of miscarriage or stillbirth. We've not seen any impaired fertility if females get COVID, but we are seeing an impact on male fertility. So today, I want to review this article, Semen Impairment and Occurrence of SARS-CoV-2 Virus in Semen After Recovery from COVID-19. Okay, so this is a study that we're going to break down, and we're just going to do a little lit review really quickly. The first thing that's important is we need to understand sperm and eggs are such different. I mean, obviously they're different, but sperm is so different. So unlike a woman who is born with all the eggs she's ever going to have and they just run out over time, men are constantly regenerating sperm. Sperm is developed in the testes. So there are germ cells, and sperm develop as they grow through the testes over the course of approximately 72 days. It then takes around 18 days for the sperm to get from the testes into the ejaculate. So sperm has to grow, and then it has to be transported to where it's going to go. That's about a 90-day lifespan. Every single day, there's different sperm in different stages of development. This means that your sperm can be exposed to something, and they're very sensitive. So let's look at a sperm. Sperm are really sensitive. A sperm has a head, which its entire job is to protect some DNA. And then it has a tail, which job is to make it move. And so sperm are developed, and they are extremely susceptible to the environment. And we know this. We know that male lifestyle factors can play a role in semen analyses. Things that can impact sperm parameters can include exposure to toxins like cigarette smoke or marijuana, things such as heat, so constantly submerging the testes in hot tubs or saunas, even maybe riding motorcycles, and other health problems such as obesity or high blood pressure or cholesterol, and even getting sick. So having a recent illness can impair your sperm parameters. We've known this for a long time. So a good example in history is mumps. If you get mumps, one of the consequences, you're probably going to live and be fine, but mumps causes atrophy inside the testes, and you can have azoospermia. No sperm in the ejaculate. It can destroy the testicular function so they can no longer make sperm. And so you see men who are sterile, who have no sperm, after having mumps as a child. Obviously, with the invent of vaccines, the MMR vaccines, as measles, mumps, and rubella, this prevents those from getting mumps. We're starting to see mumps become relevant again as people aren't vaccinating. I think this is going to have reproductive consequences later on. Issue. So mumps causes this issue called mumps orchiitis, where we know that the testes get inflamed and it destroys their cells. What about COVID? So even getting really sick with just a flu, we sometimes see drop in sperm parameters. But this hasn't really been looked at in COVID, even though we, your reproductive endocrinologists, have been saying that we've been observationally seeing this. So now we're going to go over this study, which is looking at a few different things. But the thing I thought was most interesting was how sperm looked in the ejaculate after recovery from COVID. So the study question: how was the semen quality of sexually active men following recovery from severe acute respiratory syndrome COVID-2? Okay, so one fault of this study, in my opinion, is that there's no control group. Everybody has gotten hospitalized. The control group is men who did not get hospitalized. So how I interpret this question is looking at how does the severity of disease impact your semen analysis? Because your control group, what's considered normal, men who had COVID who did not have to get hospitalized, what happened to their sperm, compared to men who had COVID and were hospitalized or hospitalized and in the ICU. So we're really looking at the severity of infection. Importantly, none of this has a control group that's baseline. So what is baseline? Men who don't have COVID. We're going to use normal semen parameters to compare those two because we have that for normal population-based levels. But when we talk about statistical significance, understand that they're comparing everybody had COVID in the study. So we're not looking at the guy who doesn't have COVID. This was a prospective cross-sectional study. This means that we looked into the future at a subsection of the population, which in this case was 43 men. Small. So this is a small n, small number. We're taking a very small sample size and we're trying to apply those results to the general population. We looked at biological fluid, we looked at semen, urine, and saliva. And these men were known to have recovered. So before entry into the test, they actually had negative tests first. A couple things to note. I always like to look at table one. Table one in any study should be your demographics of your groups. And so what we're looking at here is, are there major differences between the people who got hospitalized and who were not hospitalized? There were in this study, and that may impact our results. So look at this right here. Your median year in age, so the non-hospitalized was 44 years, the hospitalized not in ICU was 52 years, and the hospitalized in the ICU was 59 years. This is old. I mean, we know that men can reproduce older than women. This is kind of rubbing it in a little bit, but that was statistically different. So already the people who are in the ICU tend to be older, therefore their sperm parameters may be impacted as well. And I want to pull attention to this one factor right here. Period between last negative swab in days. All of these are between, 24 to 37 days. So at least a month time has passed before these men had their samples given and when their last negative test was. So that was their negative test. So presumably at least 2 to 3 months from when they were first diagnosed with COVID. So when we look at semen analyses, what are the factors we look at? We look at the volume, so we look at how much ejaculate there is. We look at the concentration, how much sperm is per milliliter. We look at the motility, how does the sperm move? And we look at the morphology, the shape of the sperm. So compared to normal, I'm gonna look at the non-hospitalized group compared to normal. There was normal amount of sperm volume, normal sperm concentration. The motility is low. So already we have a low motility in the non-hospitalized group, and the morphology is low. So compared to men who have not had COVID in our population-based studies, we have low motility and low morphology in men who have had COVID and now have 30 days from a negative test, even if they had a mild infection that did not require them to be admitted to the hospital. When we look at the hospitalized and the ICU admission, we see a change in these. You can actually see the sperm concentration goes from 65 million per milliliter in the non-hospitalized group, 17.8 million per milliliter in the hospitalized group, which is borderline, to 0 to azospermia in the ICU group. The motility significantly drops in the hospitalized and the ICU group too. You have motility in the 20%, where it was 36% in the non-hospitalized and 50% is normal. And the morphology across the board is low. 2%, 3%, 0%. We like to have at least 4% normal sperm under strict parameters. Okay, here's how I take this data. All men who have COVID infection in this study, 43 of them, small sample size, had an impairment in their semen parameters from normal even upon recovery from COVID of at least a month. This is important, especially when it comes to motility and morphology of sperm. Because a sperm's lifespan is 3 months, it usually takes 3 to 6 months to see a full recovery of the semen analysis. If you're 25 and your female partner has normal anatomy and ovulates, then 3 to 6 months is probably not a big deal. If you're 41 as the female partner trying to get pregnant and you have to wait 3 to 6 months to get sperm into the ejaculate or to get it normal to get you pregnant, that may be closing your door to have a child. And you may need to accelerate treatment depending on your own factors or how many kids you want. And I think that's really important to note that nobody is talking about. Also, if you have a severe case of COVID, you may actually have azospermia, no sperm in the ejaculate. That's not just a low chance of getting pregnant, that's a no chance of getting pregnant. Take-home messages. COVID impacts sperm parameters. Likely will return back to normal, but I don't have this data yet. I am not anticipating these severely ill men have COVID, go azospermic, and never get sperm again. Although we need that study to prove that that's happening. But just in clinical practice, that's not what we're seeing. However, getting COVID, even a non-hospitalized infection, may lead to detrimental sperm parameters, specifically motility and morphology, and severe infections impair concentration as well as motility and morphology. This may have significant implications if you're trying to get pregnant. So, summary. If you've had COVID or you get COVID, you're trying to get pregnant, you should consider getting a semen analysis so that you can understand what you're working with. Talk to your fertility doctor. We may change your treatment plan. Number 2, specifically if you're trying to get pregnant in the near future or right now and you're eligible for the COVID vaccine, please go get it. Not getting COVID is the best thing you can do if you're a man for your fertility at the current point. There is no evidence that the COVID vaccine impairs sperm production in any way. There's not even a hypothesis that that's happening. There's not even a fake Facebook post that would exist. So there should be no reason stopping you from going to get that specifically if you're really trying to conceive a child. Thank you guys so much for listening. Hopefully this was a little bit helpful. Always trying to bring the latest research. Let me know if you like lit reviews, if you want more of them. Let me know